My patient, Samuel Williams, had severe chest pain, had a heart attack, and was taken emergently to the catheterization lab by Dr. Mayer. He was able to stop the heart attack with a stent to his right coronary artery. Well, Mr. Williams also had other blockages that required bypass. So we waited about a week until things looked good, and I took him and did the bypass operation. Got him up to the ICU, and his nurse was Jessica Amdahl, who's quite skilled, and I was comfortable at that point and expecting only good things to happen. However, within about an hour of getting to the ICU, Mr. Williams developed an arrhythmia, and then his heart stopped. So Jessica called for help, started CPR. I came to the bedside, as did the anesthesiologist, Dr. Russell. And after some medications, it was apparent Mr. Williams' heart was not responding. So I decided to open his chest. I don't know if you've ever been in a situation like that, but it's a little like pulling out a single snow cone in front of my 5 kids. It's just chaos. And fortunately, Dwayne Stark was there and was able to coordinate the other nurses to help me get what I needed. So I opened his chest there in the ICU. Indeed, his heart was not beating at all, so I started to squeeze it with my hand. And we kept giving medications, and at that moment I prayed, Lord, save this man. We kept working, and as the minutes dragged on, I began to feel a sense that we weren't going to be able to save him. But I saw Jessica continuing to work, and I saw Dwayne continuing to work, and so I continued to work. And after a few minutes, his heart started to quiver. And after a while, his heart function recovered. We got him back down to the catheterization lab, and Dr. Mayer figured out that it was his stent that had clotted and caused this whole problem, and he was able to open the stent again. I looked back at the record, and his heart had been stopped for 27 minutes.
I understand that somebody had to get on top of him and do the chest, where they push on your chest, keep you going, and Dr. Pruitt had to open me up again and massage my heart for 27 minutes. Well, what went through my mind was it wasn't time for me to go yet. God and Jesus has a purpose for me. That's why he saved me. If it hadn't been for that, I'd have went on right then, but he's got some kind of purpose for me to do the rest of my life.
Ultimately, he did extremely well. He did not have a stroke. He did not have any problems with his wound, and he did have some difficulty swallowing, but other than that, he had a speedy recovery and actually went straight home. He didn't even go to rehab.
I do a lot of walking, and then I've got a little shop there behind my house. I like to work with leather, and I like to make custom-made knives, like hunting knives.
The lesson that I take is that what we do is a team effort, that I try to provide a superb operation for my patients, but sometimes things come up that we don't expect, and you have to have a high-quality team around you that can activate and do those things that are unexpected, go above and beyond what they're normally used to, and do it in an excellent way. So I'm not sure what your concept of a miracle is, but I was there that day, and I can tell you what I saw. I saw a man who went deep into the valley of the shadow of death, and he walked out. And I thank God for that. I thank God for people like Jessica and Dwayne, who have the skill to do amazing things for their patient, but also the determination never to quit until the patient is well.
I remember both of them. I don't remember exactly what they done. I just remember being there by the side of my bed. The attitude, not only those two people, but all the staff, the nurses and their helpers, when they came in there, they had a good attitude towards me, and that meant a lot to us.